Now, some of those things that a lot of nurses fail to study would be basic things like ethical principles. And sometimes even if they study it, even if they memorize the definition, when they're given a scenario or a situation, they are unable to apply what they know. Okay, this time I will make it clear for you guys. So that's going to be easy for you to remember ethical principles. So let's just deal with the most common ones. Okay. Veracity. Veracity simply means truth-telling. Let me first define before I give you examples. Autonomy simply means the freedom of choice, freedom to decide for oneself, or self-determination and privacy. Beneficence simply means duty to promote well-being of others, doing good for others. Non-maleficence simply means do no harm, okay, or minimize harm. And finally, justice, fairness. Okay, let me simplify this thing using one scenario that I'm going to revise to show the different implications of each ethical principle. Let's begin. Here's a mother with a baby, and the baby is actually for vaccination. The mother is also for flu vaccination. So the mother asked the nurse, will having the flu vaccine treat flu? So that the word that was used is treat or cure my flu. Okay? How would you tell the truth? Tell the mother that the use of vaccines is preventive in nature. It will help prevent you from having flu, but it is not going to treat an existing flu. So vaccines are preventive, okay? If the mother asks, will I have side effects like fever if I have my vaccine? When you decide to tell the truth, yes, you will have mild fever and pain at the injection site after vaccination. That's veracity. Okay, that's veracity. Okay, now using that same scenario, the mother and the baby. So when the mother said, when the mother asked, will I have side effects if I had my flu vaccine? And you said, as a nurse, you will have pain and mild fever. And so the mother said, okay, I'll have the vaccine some other time, not now. And you agreed and said, okay, that's your choice. That's acknowledging autonomy, freedom of choice of the patient. Okay? Now, knowing for a fact, when the mother came back for vaccination, knowing for a fact that the mother would experience pain and will have mild fever if she gets vaccinated, but still, you administer the vaccine because it will promote well-being. It will help prevent the flu despite the pain and the mild fever. That's the principle of beneficence. You administer the vaccine despite there will be pain and there's going to be mild fever because it's done to promote well-being of the patient. That's beneficence. Now, when you are injecting, when you are preparing the injection, you notice that the mother whom you are going to inject with the flu vaccine is very thin and have poorly developed muscles. Okay? So you made a conscious effort to choose the smallest needle possible so that to minimize the pain on the mother because the muscles are underdeveloped. So you don't want to do harm. That's non-maleficence. That's non-maleficence. Okay? Now, since you have the mother and the child coming to you for vaccination, the mother has had flu previously and the baby, okay, the child, okay, who is also to be vaccinated with the flu vaccine, okay? Who among the two, who between the two should be given priority if there's only one dose of vaccine left? Will it be the mother or the baby? Since the mother already had previous exposure, it would be more logical if you protect the child who is more at risk and vulnerable. And that's the principle of justice. You are being fair, equitable distribution of resources. So you see, you have one situation that tells us that these ethical principles could be applied depending on the need. So when you're studying ethical principles for the test, avoid canned answers. You have to analyze. For example, if you choose to administer the vaccine using the smallest needle to cause more harm, then that's a representation of non-maleficence. Okay? If you decide to prioritize giving vaccine to the most at-risk patient, then that's reflective of the principle of justice. If the patient asks you, will it be painful if I have the vaccine? And you became honest and you said, yes, you'll have some pain and some fever. That's veracity. If the patient said, I'll just have the vaccine some other time, not now, but I'll be back, and you allow the patient to do that, that's freedom of choice, that's autonomy. Okay? That's how you should remember the ethical principles. Okay, now, once again, let's try to use the ethical principles to answer a question. So here's a sample question. 75-year-old client asked the nurse, am I dying? Which ethical principle will the nurse utilize in responding to the patient? If the patient is asking you, am I dying? Tagalog, mamamatay na ba ako? Huwag ka namang rude na sabihin mo, oo. Okay. So what do we say? If the patient asks us, am I dying? Okay. You have to be guided by the principle of truth-telling, veracity. Okay. So how do you say the truth? You would say, I do not know, but if you want, I can ask your healthcare provider to explain to you your situation. Because nobody knows if somebody is dying or not. Okay? When will you die? Nobody knows. Are you dying? Nobody knows. Nobody exactly knows. Okay? So altruism means being oriented to the good of others. Okay? Altruistic. You do something for the good of others. Okay? Okay, let's move on. Now, here's a more difficult question. And I know some of you might be too lazy to read when you're taking the test, and you would say, oh, I'll have a break when a question occurs like this. But remember, when more difficult and more wordy questions like this pops out of your screen when you're taking the test, say hallelujah. Why? It simply means you're progressing to the next level of the difficulty of questions based on Bloom's taxonomy. And that is an indicator that you're going up the ladder of success. Okay, so don't feel bad when a question as wordy as this pops out of your screen. Let's go through it. Okay, so which of the following actions by a nurse demonstrate ethical practice? Select all that apply. Okay. Notifies a healthcare provider about a client's refusal to the physical therapy and his plan to discontinue the treatment. Okay, you facilitated the notification. Yes, that is ethical. Leaves immediately after work, pretending to not have been formally requested to work overtime to attend to patients. So you pretended that you didn't receive the memo. That is unethical. Documents a patient's refusal to try using an incentive spirometry despite several attempts to encourage the patient. Well, you still documented it, so that's ethical. Ask a client to request that the healthcare provider to stay when family matters without relation to any medical decisions are to be discussed. Oh, you're asking the healthcare provider to eavesdrop. Ginagawa mo siyang chismoso. That's not ethical. Tells a client who asks if he's dying, I don't know the answer to your question, but I can ask your doctor to help you understand the situation. This is ethical. Veracity. Agrees to not to file a complaint against a coworker who was seen using narcotics intended for patients after being talked to it. That's not ethical, okay? Because if you choose to remain silent despite having knowledge of what happened, then you become part of the crime, okay? So that is unethical, okay? So here's another sample question. Which of the following scenarios is reflective of veracity? Select all that apply. Veracity means truth-telling. Administering immunization to an infant, that is beneficence. Answering a client's questions with the right facts, that is veracity. Being honest about one's tardiness, veracity. Choosing the right size of catheter for a patient, that's do no harm, non-maleficence. Providing information about a procedures, risks, and benefits, okay? That's veracity. And acting like the client's parents, that's paternalism, not veracity. Okay? Okay, so let's move on. Okay, here's a test-taking key for this NCLEX Quick Fix session. Believe that you can. As they say, everything seems to look difficult before they are easy. But if you believe that you can, you will. I promise you that. Give it time and keep on believing, and eventually you will. Okay? So remember, your hardest times often lead to the greatest moments of your life. Keep the faith. It will all be worth it in the end. When you get the 4 letters of your name, USRN, and the potential to earn 5 to 7 million a year. Wow. Okay. Remember to always keep the dream alive in your heart and in your mind. Okay, here's another message from Jeneline to inspire everybody. Hey, Sir Ray, sobrang thank you po for everything. I took New Mexico NCLEX in Bangalore, India, and pass it. Sa sobrang hirap ng lectures nyo, even if the lectures are difficult, naging sobrang happy ako habang sumasagot ng NCLEX. I was happy just answering questions on the NCLEX. I'm not being mayabang, okay? I'm not showing off, but it's a fact. Started anxious, but finished with ngiting tagumpay. She started anxiously, but finished smiling. I stopped at 75 questions. I think SATA was 30, then mostly prioritization, delegation, no computation, okay? I would like to thank all your lecturers and the other profs. All hard work paid off. Every Friday, sacrifice just to attend lectures. Thank you so much. This is Jeneline from Abu Dhabi. Wow. Okay. All the way from Abu Dhabi. Thank you so much. Okay. For the kind words, Jeneline. Here's the disclaimer.